Hi, this is Fadi Al Fayoumi, and this week we're talking about the vein clinic for the Capstone A project. And in particular, we're paying attention to the revenue generation hypothesis. For this week, we spoke to three gurus in the field, and the total gurus was about four up to date. We spoke to 10 new customers for a total of 34 new customers up to date. And the hypothesis we're looking at is whether the customers, patients, are willing to pay out of pocket for the services provided by the vein clinic. And the other question that was raised for the revenue hypothesis generation, whether the insurance companies are willing to pay for treatment for vein diseases provided by the clinic. So the questions I raised for the gurus this week was how would they look um, at a cardiology practice offering vein services? How would the patients and how would the customers look at that, since that's going to be a very important factor to define whether there's going to be a revenue generating practice or not? In other means, can you be any specialty and open a vein clinic, and why cardiologists are okay to do that? And the questions we raised was, are interventional cardiologists are fit to open vein clinics? And in the scope of today's cardiology practice, since it's not only heart medicine, but it's actually a cardiovascular disease management, that vascular portion, which ideally and in the past involved only the arterial portion of the circulation, when you add the venous portion, which is still also a circulation issue, how would the public perceive that and accept it to go to a cardiology practice or interventional cardiology practice to receive vein treatment? Would that be acceptable or not? And whether this will be a challenge to raise for the insurance companies who are used to for you to bill them for cardiovascular services, but not essentially vein treatment process. And if they don't meet insurance criteria, would that be considered cosmetic or not? And, and what I get from the gurus in these questions, and that cardiologists have always been looking for different avenues in the cardiovascular field to fit themselves upon. And therefore, adding a vein clinic for a cardiology practice is something that's not new and will be a very successful idea to be pursued. And that was very assuring for our project to be a go-go as far as the cardiology practice adding the vein services. Now, when we got to the patient survey and we asked them mainly, okay, so you've got a vein disease and you're coming to the cardiology practice, and the insurance company will provide treatment for the big vein problems and the ablation issues, but what if they don't cover? In our area, which is considered a poor area, are you willing to pay out of pocket or not? So, assuming that you're having a cosmetology service and you are having a telangiectasia or spider veins, which they don't meet criteria for disease treatment, but they meet criteria for cosmetic treatment, how much are you willing to pay per session, knowing that most of those diseases and most of these telangiectasias and spider veins will require multiple sessions to improve by 80%? And so we raised the question, are you willing to pay $500 per session? Are you willing to pay $400, $300? Knowing that the national average for treatment for sclerotherapy is about $300 to $350 per session for half an hour. And keeping it clear for the patients will make you 80% to 90% better, to keep our expectations clear for them and to tell them you will come back and forth, and that's how we promise you the treatment. So in general, when we give a sclerotherapy treatment, we're talking about an investment of about $1,500. In our particular area, we found that the patients are willing to pay somewhere between $200 and $250 rather than the national average of $300. And we expected that, knowing the poverty level in our area and the patients willing to pay for this service will be compatible with possibly lower amount of money per the doctor compared if they have it done in Chicago or Los Angeles, for example. But they're willing to still pay out of pocket for this service. We asked other questions, are you willing to use a credit card? And most of them were okay with the cash. We asked about, are they willing to take loans from the banks for this? And of course they said no, but they will pay out of pocket for this service. And when we did our analysis for the sclerotherapy per se, assuming that I'm going to start the clinic with only half a day or one afternoon in my week running my cardiovascular practice, for the two new patients that I can see and 12 follow-ups, we expecting to look at revenue per month of about $9,000 to $10,000 based on the analysis we provided in the full document. That's not to mention the insurance coverage of about $1,600 per ablation therapy. And if we add this into the equation, we're looking about ten to $15,000 per month of reimbursement in the initial phase. And as the vein clinic gets bigger, of course, we're expecting this to grow more and more, and therefore our project is a go. Thank you.